But the lead story that I really want to focus on tonight is something very different. It's something that we started covering here on last night's show. And this is something that, other than our coverage here last night and now tonight, this is not something that's really had a lot of national press coverage, other than what we've done here, at least as far as I can tell. But I do think this is a really big deal. And today it took a big, unexpected turn. What this is a new and, importantly, unannounced program from the Trump administration. I say unannounced because they never put out some statement saying this is what they were going to do. The only way we learned about this new thing the Trump administration is doing is because individual families around the country started getting letters from the Trump administration, letters from the federal government. And the letters were so shocking in their implication and so surprising and so out of the blue. Again, they did not comport with anything the Trump administration had said publicly they were going to do. These letters were so shocking and upsetting that some of these families who got these letters, as best as we can tell, they took these letters to lawyers and advocacy groups, to local public officials, to try to get help in understanding what exactly these letters meant and whether the U.S. government could really be trying to do what these letters said to their families, and particularly to their kids. The panic and upset of these individual families who got these letters started to come to the attention of local press where these families live. That is how we became aware of this at all. And this has been particularly focused thus far in Massachusetts. The public radio station WBUR in Boston and the Boston Globe first picked up this story over the last couple of days. The Globe story, as you can see here, carries this very stark headline. Quote, "I feel like I'm signing my son's death warrant. Children at Boston hospitals face deportation." Now, the inset photo there on that photo is of a 5-year-old boy named Samuel Costa, who has a rare condition that inhibits his body's ability to absorb nutrients from food. And so he's a little 5-year-old kid. He has to have a feeding tube that goes directly into his torso because he can't take food by mouth. But he gets regular, expert, very delicate medical care for this rare and dangerous condition that he's got. He gets that care at Boston Children's Hospital. Boston Children's Hospital, by some measures, is the #1 pediatric hospital in this country. Well, here's the lead of the Globe story. Quote, "Severely ill immigrants, including children with cancer, cystic fibrosis, and other grave conditions, are facing deportation under a change in Trump administration policy that immigration advocates are calling cruel and inhumane. Beginning last week, Citizenship and Immigration Services, USCIS, started sending out boilerplate letters to these families with sick kids, quote, telling the families that if they didn't leave the United States in 33 days, they would become undocumented and face deportation." So we covered this story last night, and the response that we got to our reporting was frankly was overwhelming, and to be honest, pretty enraged. Up in Boston, the Boston Globe's editorial board was clearly outraged by their own news divisions reporting on this story. You can see the Globe's editorial on the subject bears this headline: "Can the Trump administration sink any lower than threatening to deport sick kids?" Here's the lead in that editorial. "Step by malicious step, the Trump administration is turning the immigration system into an apparatus of appalling intentional cruelty. The latest case in point is a relatively small program known as Medical Deferred Action, in which immigrants without legal status who are suffering from serious medical conditions are granted a reprieve from deportation so they can have access to much-needed medical treatment in the United States. Trump halted the program this month, threatening to deport these patients, including children with leukemia, children with muscular dystrophy, children with cystic fibrosis. The program's termination means suspending or interrupting the children's medical care, which in some cases is virtually a death sentence." Democratic Senator Ed Markey of Massachusetts attended a press conference with a number of these families who have just been told to take their kids out of medical treatment and get out of the country. Senator Markey's take on this last night, as we highlighted on last night's show, is this. Quote, "It is unconscionable. It is just wrong. We have now reached the most inhumane of all of Donald Trump's policies." He said, quote, "The Trump administration is literally deporting kids with cancer." Now, again, there are a few things that are at least at this point, unusual or sort of unknown about this story. Without a lot more reporting on this nationwide, I think it's going to take us a little time to get to the bottom of this. But as we are trying to figure out what's going on here, it's particularly interesting that this is a policy change that hasn't been announced, which I think ultimately starts to become important in terms of how well the Trump administration is coping with what they're trying to do to these kids. I mean, they just started sending letters to parents whose kids are receiving life-saving medical care that they can't get anywhere else. They just started sending these letters to those kids' parents telling them that they need to get out now. Right now, you've got 33 days. Yes, we know your kid is receiving ongoing life-saving medical treatment. We don't care. Stop the treatment and leave. Now, it's possible, as I said, the news that we've been getting about this for the first few days has been out of Massachusetts. And I don't know why that is. I mean, it's conceivable that Massachusetts has maybe been targeted here because they've got Boston Children's Hospital, right? They've got arguably the best children's hospital in the country. So Boston Children's Hospital is a place where a lot of kids who have life-threatening illnesses and super advanced, delicate medical needs, a lot of kids are getting treated at that hospital. So maybe that's why this new Trump administration policy is surfacing there in this concentrated way. We don't know exactly. But these initial new reports do come from the Boston area in Massachusetts. In Massachusetts, there's an organization called the Irish International Immigrant Center that doesn't just serve Irish immigrants, it serves everybody. They happen to have a whole bunch of clients who have sick kids, who have kids who are getting advanced life-saving medical care, clients who have received these letters now ordering them out of the country. Well, here's what their legal director told us last night here.
They're saying that they have the power to just eliminate it altogether, which is what they've done, and that there is no appeal. I don't know why they came up with 33 days, but yeah, they're telling these people that they need to leave on their own, and I don't know how they expect parents to pull their children from hospital beds, disconnect them from life-saving treatment, and go somewhere where they know the child's going to die. But that's what they're telling them to do.
So that was here on this show last night. This emerging news that the Trump administration has quietly, without announcing it, implemented a new policy that specifically targets kids with cancer and other terminal and life-threatening illnesses, and is now telling their parents they must stop medical treatment for their kids and get out immediately within 33 days with no right to appeal. You can see why I imagine that this is the kind of story that ultimately will get a lot of national news coverage, even if it hasn't yet. As of our coverage here last night, most of what we were able to learn about what's been going on in this story is out of Massachusetts, out of the Boston area specifically. But now today, the Miami Herald has the story. Miami Herald has the story because they say now they, too, are seeing some of the same things happening to families in South Florida. Quote, the Trump administration is ending a federal program that removed the threat of deportation, at least temporarily, for immigrant families facing serious illnesses such as cancer. The Herald says they have obtained several of these letters that have been sent to families where somebody in the family is receiving life-saving medical care. Quote, the Herald reviewed the case of a Miami man whose child was diagnosed with metastatic stage 4 neuroblastoma, a type of cancer that develops in nerve tissue. The man received a rejection letter for his application to the Medical Deferred Action Program on August 13th. The man tells the Miami Herald he is desperate to stay in the country and to remain with his daughter. Now, as I said, we are just seeing these initial news reports of these cases, these news stories emerging locally, right, where families are telling advocates, they're telling the local press, they are in some cases telling public officials that they have received these letters from the Trump administration, essentially demanding the deaths of their children, right, demanding that their children stop receiving medical treatment that's saving their lives, stop treatment and get out of this country. We are seeing these cases emerge so far in Massachusetts over the last couple of days, now in Florida today. We have every reason to believe that this is happening all over the country. As we have been trying to further report this story today, what emerged over the course of this afternoon was no further clarity on why the Trump administration has decided to prioritize, you know, kids with cancer in terms of who they're going after next. To my surprise, we also got no further clarity today on where else in the country this may be happening. Still, these reports that we've got are from Massachusetts and Florida, and we're not seeing news reports from other places, at least that we could find today. We are looking for that local coverage because I think that's going to be how we figure out what the scope is of what the Trump administration is trying to do. What did emerge today, though, is that as this new Trump administration policy targeting sick kids has started to receive just the first little bit of scrutiny, it's essentially already blowing up what the Trump administration is trying to do. Honestly, there has not been a lot of national pressure on this story yet. I think we are the first national outlet to be covering this at all. But as the Trump administration has just tried to answer basic questions about what they are doing here, about why they're sending these letters and what this means and why they've brought about this change in policy that's going to have such dire and specific humanitarian consequences and potentially fatal consequences for kids in this country. As local radio stations and the first newspapers start to call the administration to figure out what is going on here just to get comment for their stories, the Trump administration is already completely flailing on this. They have no idea what to say about it, and apparently they didn't really understand what it was they were launching when they started this program attacking these kids and when people finally started to ask them to answer for it. And I will show you what I mean. After WBUR, the public radio station in Boston, posted their groundbreaking, terrifying initial story about these kids in Boston being targeted. Kids being treated at the Children's Hospital in Boston, kids with rare genetic disorders, kids with cystic fibrosis, kids with seizure disorders. After WBUR published their first story, they apparently, hours after publication, received a whoa, 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 whoa kind of comment from the U.S. Customs and Immigration Service that had sent out these letters to these families, right? These death sentence letters to these families with sick kids. Customs and Immigration told BUR after they published their first story that they wanted it to be known that this medical deferred action program that had been allowing all these kids to stay alive, despite what you might have seen in these letters, that program isn't ending per se. It's just being shifted to a different part of the Trump administration. Quote, medical deferred action requests are now submitted to ICE, different agency, for consideration. Oh, okay. That's their first explanation when they get their first hard questions. So yes, yes, family in the Boston area, you've been told you have to get out of the country and stop providing life-saving treatment to your ill child. But what we didn't mention is that some other part of the Trump administration might be able to help you out so you can keep staying. Oh, did nobody mention that to you? That was their first explanation, right? Now it turns out the other agency that is supposedly picking up this program, the other agency inside the Trump administration that supposedly is going to process these requests for dying children to stay here in order to receive medical care that's keeping them alive. Now we find out that agency actually is not doing this. They have no intention of handling these kinds of requests for kids in this kind of circumstance. They have no program like this. And they say today they have no idea why some other agency in the Trump administration has been telling reporters now that they do. Great. Here's how this played today in the Miami Herald. You can see it play out. Quote, 3 officials with ICE who asked not to be named due to fears of speaking outside official channels tell the Miami Herald today that the agency was blindsided by the move. Quote, high-level sources said that management at the agency had no idea U.S. Customs and Immigration was transferring over deferred action responsibilities, noting that ranking officials were scrambling to respond to the unexpected move. That's how it played at the Herald. Here's how it played at WBUR in their follow-up story today. Quote, an ICE official told WBUR that the agency was not informed by U.S. Customs and Immigration that that agency would stop processing the deferral requests. Quote, there is no program at ICE that's going to take over that function. ICE is not going to implement any sort of a program or procedure or policy to take over that function. We'd like U.S. Customs and Immigration to clarify what they mean. That's how it played at WBUR. Here's how it played today at NBC News. Quote, an ICE official, speaking on the condition of anonymity, said ICE was blindsided by the U.S. Customs and Immigration decision to refer all immigrants applying for deferred action to them. ICE currently has no plans in place to review these applications. Quote, ICE does not have a program for this, nor do we plan to. At Commonwealth Magazine in Massachusetts, which has done some great reporting already over the past couple of days on this, their reporter got this. Oh, God. Quote, ICE and U.S. Customs and Immigration Service officials allegedly had a meeting for the first time about this policy this morning, meaning this morning, Wednesday morning. ICE is 100% punting this back to Customs and Immigration. Just take a step back from this for a second. We're going to talk to a lawyer who is right in the middle of this fight, who's trying to represent some of these families and keep some of these kids alive. We're going to talk about that in just a second. But just take a step back from this for a second. Imagine being in charge of the federal government of the richest and most powerful nation on earth. and deciding that what that government ought to work on is figuring out, where are all the really good pediatric hospitals in this country? And then trying to figure out if there might be kids in those hospitals who are currently receiving ongoing treatment that is saving their lives. So you could somehow figure out a way to force a stop to that treatment and kick those kids and their families out of this country so that they can no longer get the care that's keeping them alive. Kids with cystic fibrosis, kids with cancer, kids with rare diseases. Imagine being in charge of the US federal government and choosing to use it for that purpose, to target the power of the US government at children with cancer. Then imagine that once you have decided to do this, you what? Hoped nobody would care or nobody would notice because heck, it's just immigrants. And you're not planning on announcing it. And so therefore, you figure you're never going to have to answer for it. So you come up with no plan for how to explain this when people, local officials, local reporters, local news outlets, local advocacy organizations, people inevitably come to you asking questions about what the heck you are doing in the name of the American people. And so having come up with no way to explain this, your makeshift response is to say, oh, it's actually no big deal. Some other agency will take care of it. Yeah, we're not doing this anymore, but we're sure somebody else is. God, it sounds terrible when you say that we're going to be sending kids with cancer to their deaths. We're sure somebody else is taking care of it, right? Some other agency? You guys, they're doing it. And the Trump administration has no idea what it is doing or how to handle the inevitable reaction to this from the American people. They have no idea what they're doing here, except for the fact that they have decided to tell parents that they must withhold life-saving ongoing medical treatment from their seriously ill kids on orders from the U.S. government so that they could get out of this country because President Trump wants them out. Imagine being a U.S. official who's been doing that kind of work. And now imagine being the parent of a sick kid who's holding onto one of these letters sent to you by those U.S. officials and realizing that this is now what you are up against and that this is the exact way your child's life is being put at stake. In the very short term, over the next 30 days, by this president, by this administration and the people who work for him and their priorities. Imagine.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.